In this video, I'm going to show you how to apply the Cantharidin therapy to molluscum, period. So please read my information about it that I have in the share drive under clinical information under Cantharidin therapy. There's both a provider information document as well as patient instructions. We also can print out patient instructions after we do it. So post-procedure instructions, I would suggest you print those out and read them. They can be found in our EMR under the assessment and plan, right next to where you would actually order the treatment. Okay, so a few things to know. Remember, first treatment, we treat 5 or less lesions. Don't treat them if they look like they're about to pop, because if they're about to pop, they're resolving. On subsequent treatments, which can occur at 2 to 4 week intervals, no sooner than 2 weeks, we can treat up to 15 lesions, which I've done that, and it all works very successfully. Do not treat folds, intertriginous areas, the first time, and don't treat the face the first time, because you don't know how much of a reaction the child's going to have. But on subsequent visits, if you think this kid doesn't react too strongly to it, you can treat those areas. But please make sure you let people know about the potential for scarring and hypopigmentation with lesions treated on the face. Obviously, you're not going to treat near the eyes, that you be wise about that. Okay, so when we treat, this is a very strong blistering poisonous agent. So I suggest first you make sure you put your gloves on before you do anything, before you even get out the medicine, because all kinds of things, I can tell you, in doing it 5 or 10 times, I've had all kinds of things happen to me. So get your gloves on first before you do anything. You're going to have the little box that has Band-Aids, the circular Band-Aids. It has sticks. You'll see those in a second. And it has the Cantharidin. I want to keep it in a plastic, and it's screw top. You have to make sure you screw it tightly when you use it. I suggest you have something like this, like a area where you can put the Cantharidin therapy on top of, okay? And then you need to be making sure the children that you do this on are compliant kids. I definitely would not do it on a young child that's moving around, because you have to be very careful when you apply it. So you also want to have your marker, okay? And a tissue, and you'll see what I'm talking about in a second. You want to have an assistant. So I would do this with a nurse. Don't do it by yourself, because to do it quickly and efficiently, you need somebody putting Band-Aids on the spots as soon as they're done. So what you're going to instruct the nurse to do is tell her how many lesions you're going to treat, have her get out the Band-Aids out of here and have them ready, okay? And then what I would recommend doing is also getting your sticks out, decide how many you're going to treat. You only use 1 stick per spot. Don't double dip your sticks inside of the therapy. What I've been doing is I break the sticks in half, so each 1 stick can treat 4 spots. I keep my unused ones on one side, and I usually use a garbage can, or I put my used ones on another side. That way you're not confusing which ones you use and don't use. Decide which lesions you're going to treat ahead of time. Always do this ahead of time. Draw a circle around the spots that you're going to treat, like pretend the spots are right in the middle there. Draw a circle around those spots, so that, because this medicine dries very quickly, so that you know which ones you treat for when you're putting the Band-Aids on, and the parents also know later, if it blisters up, whether it worked or not, which spots were treated. Get your Cantharidin then out. Remember, you're using your gloves. Make sure the patient knows not to wiggle, not to squirm, because you don't want to get this on anything but the spot alone. Make sure your patient knows this does not hurt at all, but they are just to stay still. I would hold it tightly over a very compliant child. Dip, get a little bit onto the edge of the stick, okay? And just drop it directly onto the molluscum only. Don't put it on the surrounding skin. There have been some times where on repeat therapies, I have done a little bit of a broader application to it when I see that they don't scab or react very strongly. But apply it directly. So you're done with the first one, you grab your second stick for the next one and apply directly there again. And maybe if you think you have an extra drop, I have done it where I've taken a big drop and I've applied it to multiple at the same time. Have your nurse put the Band-Aids on each of those. When you're done, close the cap. Make sure you feel it close tightly, okay? Put it back in here, and then just put your items back inside of your wart box, okay? with the marker and everything, and then you're done. It's pretty simple. I'm not going to go through the instructions about what to do after you apply because you can read those. If you have any questions, let me know. Thank you.